A blood clot is a normal repair process of the body and often has no consequences. But there are situations where they form when they're not needed. This makes detecting the warning signs much more important. Today, with the help of some experts, we are going to provide you with the top warning signs of a blood clot. But first, why don't you hit that subscribe button and click the notification bell as well, because we're the best place on YouTube for all your health tip needs. Okay, so let's move on to blood clots. Blood is constantly flowing and in motion throughout the body. The heart pumps it through your arteries and is then returned to the heart. Without constant motion, blood can become stagnant, which results in clots. But before we get into the warning signs, the risk factors, and blood clot prevention, we need to talk about deep vein thrombosis. Deep vein thrombosis, or DVT for brevity's sake, is the name for when a clot forms in one of the major veins deep inside your body. Mostly, it'll happen in your legs, but it can also happen in your arms, pelvis, lungs, or even your brain. There are at least 900,000 Americans each year affected by these every year. These are the most serious of blood clots and should be examined by a medical professional immediately. Now that we've gotten deep vein thrombosis out of the way, let's move on to the rest of our guide to blood clots. Before we look for warning signs, we have to ask ourselves, what are the risk factors? Risk factor number 1, age. Especially if you're 65 or older, you're much more at risk of blood clot. Keep an eye out for these if you're a senior. Risk factor number 2, traveling. Especially lengthy travel, such as any trips that caused you to sit for more than 4 hours at a time. They make you much more susceptible to blood clots. Try to keep your blood flowing at all times, even if you're on an airplane. Walk down the aisle. Heck, try to talk to other passengers. Risk factor number 3, lying around. Bed rest or being sedentary for long periods of time makes you a lot more likely to get a blood clot. We know how awesome it is to sit around and watch Netflix for 8 hours a day, but try and move around at least a little. Risk factor number 4, being overweight. People who suffer from obesity are very blood clot prone. If you're thinking of changing your weight, we here at Bestie have a lot of cool videos about weight loss and dieting. Risk factor number 5, being pregnant. Pregnant women are incredibly susceptible to blood clots. Risk factor number 6, lineage. By this, we mean if you have a family history of blood clots. Make sure to talk to your other family members to see if they've ever suffered from them. If so, talk to your family doctor. Risk factor number 7, smoking. Those that are smokers have a bigger risk of getting a blood clot. If you do smoke, quit, or in the very least, cut down a whole bunch. Risk factor number 8, birth control. Turns out that certain birth control pills can cause, or at least contribute to, blood clots. Talk to your doctor about what the side effects of your pills are. Alright, so now that we've talked about the risk factors, keep watching to see what the top warning signs of blood clots are. Warning sign number 1, swelling. If a blood clot forms in your arms or legs, deep vein thrombosis, you could experience swelling. DVT is more likely to occur if you've had surgery, don't move often, or if you've been on a plane for a while. Warning sign number 2, color change. If you notice that an area of your body becomes itchy or turns red or blue or has a red streak, you may have a blood clot. The change in color suggests that the area is tender and swelling. Warning sign number 3, pain. Your limbs need circulation in order to move. When it's cut off, blood clot, it can cause inflammation, which leads to acute or severe pain in the limb affected. Warning sign number 4, breathing issues. This can mean that the blood clot has moved from your arm or leg to your lungs. You may experience a rough cough, or even cough up blood. Dizziness and pain in the chest are also signs. If this happens, get medical treatment immediately. Warning sign number 5, racing heart. When you have a blood clot in your lungs, your O2 flow slows down. This causes your heart rate to speed up to make up for the slow O2 flow. Warning sign number 6, speech or vision issues. A blood clot in the brain can be caused by fatty deposits in the blood vessel walls that deposit blood into your brain. This can cause vision and speech problems, seizures, and a feeling of weakness. Warning sign number 7, nausea or vomiting. A blood clot can occur in our veins that drain the blood from the intestines. It can cause nausea, vomiting, blood in the stool, diarrhea, and pain in the stomach. Warning sign number 8, high blood pressure. If you have a blood clot in your kidneys, it can keep them from removing waste. This can cause kidney failure or high blood pressure. You may also experience a fever, blood in your urine, trouble breathing, and sudden leg swelling. So finally, let's ask ourselves, how does one keep from getting blood clots? Well, luckily, we've consulted a myriad of sources to teach you the do's and don'ts of how to prevent blood clots. Prevention tip number 1, wear loose-fitting clothes. As we said, blood needs a constant motion in order to not clot. One of the ways to keep your blood flowing is to make sure that your clothes don't restrict any of your limbs, especially your legs. We know you love wearing those skinny jeans, but maybe restrict it to once a week. Prevention tip number 2, raise your legs. You should raise your legs 6 inches above your heart from time to time. This will help you move your blood around a little, and best of all, preventing from clotting up. Prevention tip number 3, exercise. Everyone compares exercising to getting the blood flowing. Yoga and deep breathing exercises are great ways to boost circulation. In time, walking can also strengthen your heart and improve overall cardiovascular health. We can also assure our viewers that exercise in general is great for blood flow and thus is great for preventing blood clots. Prevention tip number 4, change your position often. We talked about this briefly in the risk factors, but if you're sitting or standing for a while, you should switch around. This will get all those juices that keep your body going moving around. You should never sit or stand for more than an hour. We know you might look silly bopping up and down every 60 minutes, but at least it's better than getting a blood clot. Prevention tip number 5, eat less salt. Correlation between bad circulation and eating salt when they say excessive salt intake can also increase stiffness of the arteries and cause ventricular hypertrophy, or an enlargement of the heart's muscle tissue, making the heart pump with less force, so just cut down. Prevention tip number 6, protect your legs. We're already aware that your legs are in the most trouble, especially when it comes to getting deep vein thrombosis. So, you're gonna wanna protect those babies at all cost. Do your best not to bump or hurt them, and especially don't cross them. Either way, you're going to be cutting off circulation if you cross them, or focusing too much blood to one area if you bump them. Just keep an eye out and be careful. Prevention tip number 7, stop smoking. Smoking raises the risk of unwanted blood clots and makes it more likely that platelets will stick together. Smoking also damages the lining of the blood vessels, which can cause clots to form. All in all, just stop smoking. If you need help, there are plenty of resources online, and if you're really struggling, ask your friends and family for a hand. And that just about does it. We hope you learned a lot today about blood clots, especially about how to prevent them. But did we forget anything? Are there any blood clot experts out there who would like to share their advice with their fellow Bestie viewers? Let us know in the comment section below everything you know about blood clots, from your experience to your tips on how to keep them from happening.
Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of Bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.